In the era of injectable fillers taking over everything in terms of facial aging, from lifting to line enhancement to even augmentation of cheeks and chins, I've had a lot of questions about how do you do, and if you even do, chin and cheek implants anymore. And of course the answer is yes, they're a very valuable tool and they offer a lot of advantages over some of the injectable fillers that are out there. Namely, the long-lasting effect of these types of implants. They've been around for more than 30 years now. The safety profile is excellent. And while it is a procedure, we are able to offer someone a long-term correction. I gave a little anecdote recently as I was teaching some residents in the anatomy lab at the University of California, San Francisco, and we had two of the cadaver dissections that we were doing had chin implants that were well placed, and it was quite interesting to see the aged tissue around the cadaver dissections that we were doing, and the implants looked as though they were right out of the box basically. So these implants are very safe and reliable. The main risks of doing cheek or chin implants, chin being the most common, are infection or mobilization of the implant where it becomes slightly mobile, in which case there can be inflammation set up. These risks are quite small, less than 4% in the study literature, and in my experience I've taken out one chin implant in 22 years of doing this. So it's a very common procedure, very commonly performed along with aging face surgery like facelift or rhinoplasty surgery, and quite simple. I thought I'd go through a little pictorial description of what the procedure entails. And of course, if you have any questions or thoughts about this, you're welcome to write me at Dr. Maas at drmaas.com at our blog. You can obviously send in pictures, photographs, or even videos if you like on our video blog. And I'm happy to answer questions and even do some computer enhanced imaging to show you what you might look like after a chin or cheek implant. So stand by and let us go through a small didactic on chin implant surgery. Corey Maas again, just rejoining you and talking briefly about chin implant surgery. As we mentioned in our introduction, in the age of doing a lot of injectable fillers for augmentation of the cheek area and the chin area, even along the jawline, a lot of people ask me, are we still doing chin implants? And quite frankly, we do quite a few of them. The benefits of chin implants being, chin or cheek implants being, that you get a long-term duration of effect, one that lasts really for the rest of your life. And that's a great advantage for a relatively small procedure. Chin implants take about an hour to do. They can be done in the office under local anesthesia or local with a little bit of sedation. If people want to be lightly sleeping, they can be. And it's really the same with malar or cheek implants. But basically, I've diagrammed here one of the options for incisions. A very small incision can be made underneath the jawline, right underneath the chin, as you see in this diagram here, about 2 centimeters in length, 2 to 3 at the most. Or we can go back or underneath behind the lip and make an incision inside the mouth, and that way we have no scar. Either of them are excellent ways of approaching the chin implant, which can be placed with precision to get a great result. This diagram shows then once the incision is made, we're very carefully, I'll make a small vertical incision now in the tissues below the skin, and now I've begun the creation of my pocket that I'm going to place the chin implant in. So a small horizontal incision below the chin line, and then a small vertical incision is made to create space for the chin implant to live in. Once I've done that, I use a very special dissecting tool, which is a blunt tool, but you can see it's placed through the little incision, and then it's right on top of the bone and below a very special covering of the bone called the periosteum. And the key to this operation really is to create a pocket size that is perfect for the size of the chin implant that is made for you. And I'll use this technique of bluntly elevating that periosteal layer, because in the end the chin implant is going to be placed there. A perfect pocket means perfect fit, and it means perfect shape, dimension, and distribution of the chin implant without mobility. Those are the keys to success with chin implant surgery, and you can see that that dissection is carried and extended until we have it fully elevated. Now very often then, once I have the chin implant pocket placed, I'll place one end of the chin implant into the tissues. This is all done under sterile technique, obviously, and it's totally numb, so no one would really feel this at all, whether they were sleeping lightly or even under anesthesia, local anesthesia. And I'll place that. I'll determine that the midline, which I mark at the lip, at the central incisor or the middle teeth, and that the vermilion border right at the philtral area, so that I have it all lined up in midline, and there's a little actual blue line on the implant itself that I'm using, and I'll place it to make sure it's aligned correctly, and I'll put the one side in, and once I get to the blue line, I'll know it's the full, that I've fully dissected laterally to make this perfect. Then I'll go to the other side once this is done and elevate similarly and place the implant on the other side. Now you can see in this diagram that I've got the chin implant very carefully placed with a perfect pocket on in this example, the right side, and I use a special tool, a grasping tool, to place and slide that under the periosteum on the other side, making sure that the alignment is central and midline, and with a perfect pocket, no real placement or fixation is required, like a screw or some other type of device. But in cases where we feel like the implant's not perfectly stable in the pocket, one can use a little tiny screw which stays in permanently, and it's quite simple to place. It doesn't require even drilling anymore with the newer type of self-drilling and self-tapping screws available. But that's rare. I'd say that's more like 1 in 10 cases, whereas the pocket creation that's perfect is 90% of the cases that I'll do with this small chin implant. Once it's placed and I'm assured that the contour is correct, that it fits right along the jawline, that the wings are not elevated or below the jawline on either side, and that I've carefully centered the implant, we'll do a closure of this area. Very small, very small incision here is closed with small sutures that come out or are dissolvable within a week or so, and that really is the beginning and the end of the chin implant in terms of the procedure itself. The time required for recovery for most people is about a week. The chin is puffy. Bruising is a possibility, but is not very common. And it's really the puffiness around the chin area from the procedure itself that's the only noticeable thing. So for most people, it's quite an easy procedure to perform in the office or in an outpatient surgical facility with very long-lasting results. So that's a summary of basic chin implantation. I can give a little bit of, and I will give a little didactic on malar implantation, but it's really the same principles and process when we do cheek or malar augmentation with implants that are permanent, a small incision up under the lip, a careful pocket that's created, and placement of preformed implants that are really customized to each individual patient. The beauty of the implants now, they're no longer the little buttons that just augment the chin. They're not great big, although there are different implants that are available. I think some of these that have creases in the middle are intended to create a dimple or a cleft. Some of them that are intended to be very square on the ends probably are not as appropriate as the anatomical types of chin implants that really contour right along one's jaw line, which is really in the end the great benefit of these types of materials. So as always, Dr. Corey Maas on Looking Your Best. I'm glad to have you. Please send your questions via email to Dr. Maas or at drmaas.com. So as always, Dr. Corey Maas on Looking Your Best. Please send videos, photographs, and or messages to us at drmaas.com. We're very happy to engage in a dialogue about the benefits and risks, and if you send photos, I'm happy to morph them, change them, and show you what you might look like with cheek, chin implants, or any of the other services that we've talked about.